Welcome back to the chronic disease self-management videos. In our last video, we discussed how short-term distractions can help you manage your symptoms, the importance of sleep, and how to create an action plan for healthier life habits. This week, we will be focusing on problem solving, dealing with difficult emotions, physical activity, and reducing the risk of falling by improving your balance. This video channel can help you improve your health when you are dealing with chronic diseases. It will also be helpful if you have a health buddy, someone you can talk to apply activities from this video. If you don't have a health buddy, make sure to pause this video, ask a friend or a family member to watch this with you. Part 1. Problem solving. Problem solving is another important tool in your self-management toolbox. Let's look at some of the simple problem-solving steps. First, identify the problem. This is sometimes one of the most difficult but important steps. For example, someone might feel that poor performance at work is a problem, when the real problem is fatigue or a poor diet that is affecting their performance. List your ideas to solve your problem. Some examples of this might be: increase your fitness by taking a walk at lunchtime. Eating a healthy breakfast. See if there's a place that you can take a short nap during your lunch break, but don't sleep for too long. Call your healthcare provider to see if any of your medications cause side effects. After listing your ideas, select one method to try. For example, take a walk during your lunch break. Assess your results. If the problem is solved, great. You continue to face the problem and go to step 5. Or you substitute another idea. Substitute another idea from the list if the first one didn't work. Continue assessing results and substituting ideas until you've used all the ideas on your list. If the problem still isn't resolved, move to step 6. You also want to use other resources. If you run out of ideas to target your problem, you can make another list by working with friends, family, or your health buddy, or your healthcare provider to come up with new ideas. After having the new list of ideas, go back to step 3, select another method, and start again. If your problem does not resolve immediately, be patient. Try again. Consult your primary healthcare provider or health coordinator at your work site. Dealing with difficult emotions. It is important to know that the symptoms we experience can, by themselves, contribute to other additional symptoms and make them worse. For example, depression causes fatigue, stress, and anxiety. These symptoms can lead to pain and shortness of breath. The interactions of these symptoms come in a vicious cycle that gets worse unless we find a way to break the cycle. This is called the symptom cycle. By understanding the symptom cycle and how health issues contribute to others, we can learn to use all of the different tools in our self-management toolbox to help break the cycle at various points. In part of this video, we will be talking about difficult emotions. We all have different words to describe these emotions: frustration, anger, fear, worry, or any other difficult emotion that you may identify. These feelings are common and normal for people with chronic diseases. We often feel a loss of control over our health, and we worry more about our future and about our relationships with others. Remember, these feelings are normal, just as any other symptom, and they can happen to anyone. Here are some ways that you can deal with difficult emotions. Try physical activity or exercise. Relaxation techniques, prayer or meditation. Call a friend to talk to someone. Help someone else do volunteer work. Do something nice for yourself. Write your feelings down, or think positively about the things that you are grateful for. Physical activity. In this section, we will talk about the physical activity and exercise for fitness and fun. Being physically active means that you move and are active during the day. But when you have a chronic health condition, that be a challenge. We can still be fit and enjoy physical activity and exercise even with our chronic disease. In fact, physical activity and exercising may be two of the best things that we can do to help our condition. The benefits of being physically active are a strong cardiovascular system, good muscle strength, good endurance and stamina, good flexibility, weight control, better sleep, more energy, less fatigue, less pain, better balance, better daily functions, less anxiety and depression, and less constipation. There are 3 types of activities or exercises that make up a complete fitness program. First, flexibility. Flexibility is beneficial to stretch and loosen muscles and joints. It helps improve your balance and coordination to prepare your body for the other activities you will be doing. The recommended time for flexibility exercise is 10 minutes a day. Next is strengthening. Strengthening exercises can help make your muscles stronger by working them harder. The recommended time for strengthening exercises is 18 to 20 strengthening exercises, 2 to 3 days a week. And lastly, cardiovascular. Cardiovascular exercises are those that exercise your whole body. These include walking, biking, swimming, or dancing. If you need some ideas on how you can exercise at your workplace, look for the Exercise Anywhere flyers that are around your facility. Warning, if you have more symptoms such as pain, increased fatigue, 2 hours after you have finished your physical activities, then you have done too much. This means you should do less next time so that your workout is not as intense. Reducing the risk of falling and improving balance. The risk and fear of falling tend to get worse as we age and when we have health conditions. This is especially true for people who have problems with balance or osteoporosis. Falling can result in injury, and it's important to understand how we can improve our balance to keep ourselves from falling. Here are some simple techniques that help you reduce your risk of falling. Exercise. As we saw earlier, exercising can increase muscle strength and improve balance. Have your vision and hearing checked. It's always important to have annual checkups with your primary health care provider and report any problems that are new. Take care of your feet. Wearing shoes that are low-heeled, fit well, and have non-slip texture reduce your risk of falling. Take steps to make your home safer. You can do this by having good lighting, using handrails on both sides of the stairs, checking your carpets are firmly fixed, use non-skid mats in your shower or bathtub, have telephones or emergency life alerts accessible at all times. Make sure you talk to your primary health care provider and report any falls that may occur. Now it's time to make your action plan. Decide an area that you would like to work on this week. Problem solving, dealing with difficult emotions, physical activity, and reducing the risk of falling or losing your balance. Be action specific. Answer your questions. What specific actions do you want to take? How much time are you willing to dedicate to this activity? And what time of day or which days of the week do you plan to practice your activities? Thank you for sticking around to learn ways to improve your health. Stay tuned for next week when we will discuss making decisions, pain and fatigue management, more about exercise, and relaxation. See you soon.